Everyone. I am here with Amanda, and she's going to tell us her story dealing with CDH. And she's got someone special there with her too. She's going to introduce us to. Look at that! Aw. And our filming here is quite different than what we're normally used to, and I'll let her explain all that as well. Amanda, tell us your name and where you live and where you're at right now, and then tell us when you first heard the words congenital diaphragmatic hernia.
I am Amanda Gazave, and this is Landon Job Gazave. He is almost 4 months old. We are from North Carolina, and we are currently in the NICU at UNC Chapel Hill. And the first day I heard of CDH was September 12th, 2018, at my 19-week anatomy scan. They actually first told us that he had an omphalocele along with CDH, and I was so freaked out because I actually knew what an omphalocele was that I did not even look up CDH for a couple days. And then I did, and I was like, oh my goodness, this is huge. This is way scarier than an omphalocele. This is, and he ended up not having the omphalocele. So I got as informed, I think we found out about 26 weeks that the omphalocele was gone. So after that, our main focus was his CDH. And it's just been a roller coaster since then. So, yeah.
So tell us about his birth. Did you deliver there at UNC?
Did. So he was supposed to be born, he was due January 31st. They had me scheduled for a C-section for January 24th. He also has tetralogy Fallot, so they kind of factored in everything, and they were like, we want him to cook as long as we can, but not all the way to 40. We want to have it controlled. We don't want you to go into labor. So then he decided that he was not going to let them stick to their plans. And at one of my prenatal appointments on December 18th, he decided to raise my blood pressure, and he also had so much, my fluids were elevated so much that they decided to admit me. So then they were going to try to see about draining fluid and keeping me pregnant, but my headache would not go away. And they decided it was in his best interest, after doing an ultrasound on the 20th, to deliver him via C-section at 10:38 a.m. on December 21st. And he was 4 pounds, 11 and a half ounces, which was our biggest concern because if he was under a certain weight, he would not be a candidate for ECMO, and he made it. So he was a big 34 weeker, which was a huge relief.
Okay. You hear me talking about you.
He's not liking me talking
Aww.
about it.
Wow.
So yes, so he is over double his birth weight now, but he was also 6 weeks preemie, which obviously does not help his lungs any. So we were given steroids. That was the blessing, is that it was all in such a controlled environment. I saw your post earlier about, other countries. I'm like, oh, I can't imagine not being in a level 4 NICU in a hospital with all these great life-saving things. Because, I was thinking Christmas with my other kids, and then Landon had other plans. So he was born on the 21st instead of January 31st.
Wow. So he's had his one repair, correct?
Yes, he had his repair at exactly 2 weeks old, the day after he came off ECMO. He was on ECMO for 10 days prior to the repair.
Okay. And no complications with ECMO?
No, none that we noticed or anything. They checked it every hour, and that was like my biggest fear, was like a brain bleed or clotting, but we were very blessed. ECMO was very smooth, getting him on and off the whole 10 days. I think it was honestly harder on me than it was on him, just seeing him like that, paralyzed and sedated and all of that. So
Wow. I can
great with it.
I can hear him. Is he trached or intubated?
He,
He's trached.
he's trached. He just has like a slight leak in his cuff right
Oh,
now.
okay. Oh, it's adorable.
Yeah, I love hearing it.
Oh.
Yeah.
Can I ask why they decided to trach him?
So he has a lot of floppiness in his airway. His left lung is still just not where it needs to be. ECMO, well, I go back to my last statement. There were no complications while he was on ECMO, but it did ultimately cause some damage to his right vocal cord, which either could be repaired later by surgery or might kind of work itself out. I know of another family whose child had both vocal cords paralyzed, but now she's 3 and screams at her mom. So we're hopeful that that's not the case. And another nurse actually heard him cry the other day when he took his own trach out.
Oh.
But he had been extubated the first time. He was not ready. He lasted like an hour and a half or maybe 2 hours, and then he was re-intubated for about a month, and then they extubated him, and he was successfully extubated for about 10 to 12 days, I believe. And then he was just working way too hard, and they had to keep going up till they were right back where they started at 10 liters on high flows, 80%, and it just wasn't good. So they put him back on the vent, intubated, and he was miserable. It was a miracle he didn't self-extubate. He hated it, and the bigger he gets, the harder it was. So we finally made the decision to go ahead and do the trach, which he had done on March 14th, and it was something in the beginning that I was kind of afraid of. But kind of had put in the back of my mind, like, that's not going to happen. I've only seen a few kids with the trachs. But after talking to a couple moms whose kids had the trachs, I realized it was definitely in his best interest, and I don't regret it at all. Like, it's given us back so much normalcy that we wouldn't get if he was still intubated. So it's been crazy, but worth it for sure.
My son was trached at 4 months too, so I completely understand the fear. It's a little scary,
Terrifying
it
at
is, but it was so much easier. It really was.
I can hold him so many different ways. I can actually sit him up and comfort him when he's crying. I can see his face with no tape and kiss on his little cheeks and mouth and give him all the love. And it's like having a quote unquote normal baby again. It's, it's never going to be normal when you have CDH, but you definitely get that normalcy of the normal baths and snuggles and talking to them without, like, he can move his head all sorts of ways. They're going to work with him on tummy time soon, things that you cannot physically do while intubated. But obviously, you can't put them on oxygen if they're not able to breathe on just oxygen. So
Right.
he is definitely going to be dependent for a little while, but we will get there. So
Wow. So, do you live in Chapel Hill or did you travel in?
sorry, I had to adjust for a second. We lived in like the Raleigh Apex area. I just got us a new apartment in Apex, but we were only about 35 minutes from Chapel Hill.
That's great.
So, and I've lived here most of my life. So I was semi-familiar with the area, and as soon as we found out, I went ahead and just decided to do all of my appointments here at the hospital.
And I'm being nosy. I'm sorry. I just want to I want the viewers who don't have a child with CDH to understand what it's
Yeah,
like to travel into the hospital every day and stay as long as you can, and work a job, have other
yeah.
kids, and try to juggle all of that when you've got two completely different lives that you're trying to manage. So uh,
It really, it really is like a double life in some ways because, I go into work. I work in Cary at a salon, and I go in there and, customers that I had when I was pregnant, how's the baby? And some of them I talked about it with. Others had no idea until now when I tell them, well, he's still in the NICU, and they're like, oh, was he that early? I'm like, not really, but he has congenital diaphragmatic hernia and such on and so forth. And most of them have not heard of it, obviously, which is the problem.
mhm.
And a couple of them actually were like physicians or various medical type professions where they did know. And they were like, oh my gosh. Work is different because when you're a new mom and your child is at home, sometimes after you get over the initial hard days, it can feel like a break. But when your child is 35 minutes away in the hospital, I have my phone sitting on my station. My managers are aware and they know that I have my volume kept on. Every time that I have a break in between customers, I'm checking his angel eye camera to see what he's doing or calling to check in with his nurses. And I also have a beautiful 9-year-old who is perfectly healthy, who I've had to unfortunately put on the back burner. I mean, there's no other way of putting it. And I know other moms that I've spoken with in the CDH community say the same thing, especially when their child's that much older. It's different if I had a 2-year-old. I'd have to really split myself, but my 9-year-old's aware of what's going on. She knows what CDH is. She knows her brother is sick and needs her more than she does right now. So then, we're on the whole cold and flu season lockdown. And she has only gotten to come up here once with the permission of an attending on her birthday to meet him. So she has this little brother that she claims to love more than me, but she's only gotten to meet him one time. So it's extremely split. Like, I don't have both my babies in the same place. I am constantly back and forth. Luckily, I've been blessed where I got to stay at Ronald McDonald because during this, I was in between transitioning. As depressing as it sounds, I wasn't sure if he was going to make it while I was pregnant. The doctors, even if they promise that they're going to do everything possible, they know the reality is that only 50% of these babies survive. Landon also had other medical conditions, making it less favorable. And I didn't want to get into an apartment on my own. Um, Not knowing if I was going to be in the hospital with him for a year, 6 months, 3 months. I didn't know, who's going to pay my bills. And I had just moved out of the house I was living at with his dad. So I just stayed with family during my pregnancy. And so because I didn't really have a permanent address, I was able to stay with Ronald McDonald House, which has been wonderful because I'm 5 minutes away from him. So a couple weeks ago when we had 2 code blues, I was able to be up here within less than 10 minutes. So that, has been a saving grace, as I know a lot of CDH parents. Some unfortunately aren't blessed with that. Either there's not one near their hospital or they don't qualify for whatever reasons, but that has been, I've been able to be so much closer to him. So I'd rather, have a 5 minute drive to him and a 40-minute drive to work. But it's tough. I feel like in some ways I almost get less sleep than a mom of a healthy newborn just because I'm still pumping for him. I'm up here, and when I'm not up here, I'm checking on him and I'm at work or with my daughter. So it's exhausting. It is truly exhausting to have a child in the hospital who requires round the clock care like he does.
Wow, you do have your hands full. Um, can can you talk about when he was coding? Because for someone who's never lived through that, who doesn't know the fear of hearing the phone ring in the middle of the night, it's very hard for people to understand. Um, and if you don't have to share if you don't want to, but if you wouldn't mind.
Don't mind. No, I don't mind. That was something that we had not experienced like in the times that I kind of thought we would, like prior to his repair or immediately after his repair. And I I can be like, I don't even want to say a wimp just because I know there's so many other moms that get the same. You develop almost like a PTSD before it even happens. Like I would hear the code alarms go off and I would cry even though it was not my child. Um, just knowing that that's what it meant and knowing that it could be your kid that's next with that alarm. And we just kept getting blessed and it never happened. And I left here one night and I left pretty late, about 2 a.m. And he was doing okay. He had been struggling a little bit. They had turned up his oxygen some, but I felt okay leaving. Like I didn't feel like, that I was going to be called back for a code in 2 hours. So I get home, I pump, and then I go to lay down, and I had just started to doze, and I get a call. And they were trying to, the first time wasn't quite as severe. I mean, it definitely called for a code, but they didn't have to do compressions or anything, or give him any epi or anything like that. It was just, his heart rate dropped down, his oxygen wasn't coming back up. So they boosted his vent settings and tried to do what they could just to kind of make him bring it up, and he did. So they called me and they didn't want to come out and say, "Oh, he coded." But I asked. I said, "Well, was it a code?" And they said yes. So obviously, I threw on some clothes and rushed up there. And I was talking to him. He was completely fine and content. So I napped in the recliner in his room. And that was about 4 a.m. when he did that the first time. So I woke up around 9:30ish, grabbed some breakfast in the cafeteria, and had just come back into his room. And it was about almost 11, and I was talking to him on the side of his bed. And he kind of made a gag face. Like, I'm not even going to try to do it because it's not a cute face, but the type of face that you can tell, like, he's needing suctioned. So his nurse came in. I wasn't comfortable at that time with suctioning him, but his nurse came in and suctioned, and he was still kind of gaggy. And he started turning blue. I said to her, I said, "Is he turning blue?" She was like, "Yes." And then she called for the other nurse to come in, and then she called for another nurse. And luckily, the doctors were actually rounding on another child in this pod. Um, but they were like, "Go ahead and call it." And so they hurried up and pressed the code alarm. And I just burst into like hysterics. Like, I'm watching my child turn blue. All these doctors are coming in. The respiratory team's running towards him. They're bringing a crash cart. I'm hearing them talking about pushing epi. It's like an episode of Grey's Anatomy. Push epi, begin compressions. And so they had me go out in the hall. Like, they didn't force me to, but they kind of just had me go out into the hall so that way I wasn't in the pod in the middle of all the other babies in hysterics like that. So I'm in the hallway, the alarm's going off, the HUC, which is like the secretary, is coming up and bringing me tissues and a chair, and I'm just like crumbled in the hallway while they're doing chest compressions on my 3-month-old. It's heart-wrenching. There's no other way to describe it, unless you've been there. I mean, you can have an idea. Like I said, I used to cry every time there was a code alarm. Um, but until it happens to you, it doesn't really sink in that it will happen to you. And I just recently finished up my CPR training, and trach change, like for emergency trach change, like doing the ambu bag and all of that crazy stuff. And I'm just like, you know, they say it's not a matter of if it happens, it's a matter of when. So going home with a child like that, it's really, really scary. And I know you know that firsthand. But it is one of the hardest things you'll ever go through is to see them code or go through that.
Yeah. I do know firsthand, and I'm here. I'm here. There's lots of
Yeah.
other moms who are here, and we know. We've lived this. So if you if
Yes.
you have any fears, or you just need to talk to someone who gets it, that's
Definitely.
why our charity's here. So, let me know, and I'm always here. Um, is so you're sitting down holding him, so you're kind of immobile at the moment, right?
Yeah.
Okay, but are you holding your phone with your hand?
Yeah. Yes. I had to switch
It's
arms.
okay. Is there any way you can twist your hand around to show everyone what it looks like to live in a hospital?
Oh, yeah.
Okay.
Absolutely. I could actually just adjust my camera even. So
Okay.
we he when he was first coming back up here from, we had to go to PICU for the ECMO. Um, but when we came back, we were outside of this room in a pod with several other babies. But during shift change, he would get very upset because of the noise and withdrawing off of all the hard stuff. So he threw a fit and we got moved into this nice little room. It's really small, much smaller than our PICU room, but it's much bigger, more personal space than out in the pod. So he is king of Pod D. He's the baby that's been in this pod the longest. None of these babies have been in even half the amount of time he has.
Oh,
So this is his bed, and this is his Nava ventilator. We're going to be working near the end of the week to switch over to the Trilogy home vent, and preparations for discharge, either to a rehab facility or home. We're still trying to decide what's his absolute best interest right now. As a mom, I want him home, but I also think that he deserves a little bit more care than he would get right away with me being a single mom. So, but either way, we're working towards discharge. So that just is his monitor. The top numbers his heart rate, respiratory rate, carbon output, and oxygen levels. With him being a cardiac patient, he sats between 85 to 90. So 91 is actually pretty high for him. His feeding pump, he does have a G tube, and that's pretty much it for now. He doesn't have any medicines that are intravenously. They're all oral at this point. So
that's great.
yes, he has come quite a ways.
Wow. I want to
We
make,
used to have
oh, go ahead.
a lot. We used to have a lot. Like I used to see so many pumps hooked up, and we used to have like 4 medicine pumps going, and it's nice. Now when he does things like his crazy episodes of coding, or when he has to have surgery, we have a few more pumps going. But normally right now it's just the feed pump and the ventilator.
Wow. I want to point out to everyone that anytime they move
Say
Landon, hi Landon. Oh, he's so sweet. Oh,
hi.
that to move him from room to room or to home, and from home back to the doctor's appointments, or an emergency back to the hospital, because this is not the type of situation where you're going to just put him in a cart and take him to the grocery store. I mean, it
Oh,
is a mass production, moving him with the ventilator and oxygen and a pulse ox and a oxygen tanks, sometimes a backup generator and all the different things that you have going. And it is a I can't imagine doing that as a single mom. My hat is off to you. I Wow.
yeah.
Wow.
It's a production, And that's part of why I'm contemplating allowing him to go to, it's called the Howell Center. It's a local, semi-local rehab facility in Greenville, North Carolina. And obviously my mommy heart wants to bring him home, but I feel like I owe it to him to at least check this place out. So I'm going out there this week to meet them and ask them my questions in person and see firsthand what it's like. Um, I've heard really cute, wonderful things about them from people here that have worked there. Um, they have like baby preschool where the trach babies are like get one-on-one, but like in the same room, physical therapy and occupational therapy, and it's like daily speech. They work more with trying to get them taking feeds orally. um, I feel like he would just get a little, not more attention, but a little bit more medical attention there than he would. Obviously, I'm going to do whatever I can to do what a PT shows me to work with him. But having an actual physical therapist, an occupational therapist, and speech and respiratory therapist right there with him is so much more than me and a home nurse and my family members could offer him. So I think that it's only fair to at least consider allowing him to go there for a few months before coming home. Just kind of like he's not really at the place where he needs intensive care anymore. Um, Once he's stable on the home ventilator, there's really not much else that would qualify him for intensive care at that point. But he's still, I don't feel like he's quite ready to go home. I think he still does need complete medical care and just not intensive. But, you know, if he's on a ventilator, they won't move him to one of the other floors here. He has to be in intensive care. So I think it's going to be really good for him. I feel like it's only fair for me to consider it. So that's kind of our big decision right now that we're trying to determine within the next like week and a half. And when I leave there, they set me up the same way as the hospital. They set me up with the private duty nursing and the home care classes and the oxygen and all the things that you were talking about, the generator, the charged batteries for his vent, all the supplies that I need for his trach changes, the bags in case of an emergency to bag him through his trach. All of that will be arranged by them the same as when I'm discharged from the hospital. So that's kind of our next big thing on the horizon. I'm trying to think of it as a pit stop before home because as a single mom, obviously I'm going to do everything I can to continue to be his advocate and his nurse and his PT, his RT, his OT, everything in one. But I am only one person. I do have another child. Nobody pays my bills but me. So I'm trying to also use that opportunity to just work and work and work as much as I possibly can. So that way, when he is home, if a nurse calls out or gets sick, or she comes in late and has an attitude, and I say, "You're gone. I don't want you with my child," because that happens sometimes. You find them, I've heard of so many moms with kids with trachs where they catch their night nurse sleeping or taking pictures of their kids on their personal phone or just weird, crazy stuff. And I have to be prepared that I might have to call out of work. And I want to know that his power's not going to get cut off because I missed 3 days of work that month, you know?
Right.
So there's a medical mom is one thing, but a medical mom of a child who comes home with equipment, nobody understands except for somebody who's been there, like you and several other CDH moms. Coming home on oxygen is even just a challenge. Coming home even on a G tube is just a challenge, but coming home with oxygen, ventilator, and G tube is why they want you have to have a second caregiver. And I only have like 2 part-time caregivers. My parents are wonderful, but they also have jobs and they have their own homes and lives. So I have 2 part-time caregivers, which is another reason why I'm contemplating, let him get a little stronger, let him get a little bit more medical care besides me and these home nurses that some are wonderful, amazing, great nurses, and some of them are just looking for the check, honestly. And that's is not the same as when you're in the hospital, when you have these wonderful nurses 24/7. When you go home, it's an entirely different world. Like, I'm already sitting there like, doctor's appointments are going to be kind of exciting because that's probably the only time we're going to get out of the house together, because it's carrying the vent, it's carrying the oxygen, the emergency ambu bag, the emergency everything. You have to be prepared for any emergency for your child.
Yeah.
And it's very intimidating.
Well, hopefully he won't be on the vent very long. And
That's his doctors do anticipate for possibly another 6 months, maybe a little longer, but his little left lung just isn't quite as strong as it needs to be. And then with him also having the tetralogy of Fallot, that kind of affects how his heart oxygenates his blood. So that, his main problem as far as health-wise will always be the CDH. But he also has these other conditions. Well, I don't think I ever have come out yet since we started talking on here. He has Denai-Barreau syndrome, which is an extremely rare genetic disorder. Like, he's one of like 30 or 35 known cases worldwide.
wow.
And Denai-Barreau, the two main causes of people not surviving Denai-Barreau are CDH and omphaloceles. The CDH just goes hand in hand with several genetic problems like Denai-Barreau, Friends syndrome, Emmanuel syndrome, Chudra-McCulley. I don't think I said that one right, but there's quite a few genetic syndromes that essentially produce like the CDH. But his Denai-Barreau also comes hand in hand with other heart problems, which he has. So that's always gonna kind of, in some ways it was a blessing because it helped with some stuff before his repair. But now it's kind of, his heart can't overwork for his lungs and his lungs can't overwork for his heart. So might be on the ventilator a little bit longer than we would like, but he writes the rules. We are living in his little world, so he lets us know when he's ready for everything. These babies are so resilient. All they really need is somebody to believe in them, and then they just kind of do the rest. They let us know when they're ready for surgery, when they're ready for extubation, when they're ready for a trach, when they're ready for the ventilator to come off. Like, they show us when they're ready, for sure.
Well, he is certainly a little miracle. I mean, he's just so special in so many different ways, and it's just amazing. Look at him. Oh, he looks quite
He is a mom.
comfortable.
Is.
Wow.
That's the quickest way to sleep. I just take him out of that crib, and 2 or 3 minutes later, he is out.
Wow.
So
Um,
he is a miracle for sure.
well, I hope to come visit you guys in the hospital when I am back stateside.
Yes, very local.
Yes, I would love to meet you in person. So I hope I can do that.
We would love for that.
Great.
So come see me, Miss.
All right, well,
Hey, come see.
I will do that. I will definitely do that.
Yes.
Well, thank you so much for sharing your life with us. We're
Yes,
we're very honored.
our
Oh,
story.
wow.
That is the biggest thing that us as parents want, is awareness and for people to share our stories.
Absolutely.
I know that you know that. So
yes.
the best we can do as parents for them is to let everybody know what CDH is. Before having him, when I was pregnant, I only I wouldn't really tell my clients that much unless they kind of asked certain questions. But now it's like anytime that a client's like, "Do you have kids?" I'm like, "Yep, one has CDH. This is what it is." So
That's great.
make everybody aware. Everybody share her telethon, share the Cherubs fundraisers and CDHI International
Thank you.
because that's the best thing for our babies.
Thank you. Thank you, Amanda, and thank you, Landon, so much.
Yes, thank you, Miss Dawn. We appreciate
All
it.
right. Bye, guys. I'll see you soon.
Bye. Thank you.
Hey, this is Dean Kane. April 19th is International Congenital Diaphragmatic Hernia Awareness Day. It's a big, long name for a disease that hurts thousands of kids a year, killing 50% of them. For short, we call it CDH. All right, and we're trying right now to raise some awareness for this disease and help out these kids. www.cdhi.org. So, look, donate, help out the kids. This is for charity. Do something nice for the kids. Cheers.
Hi, I'm downtown Julie Brown. Did you know that CDH affects 1,600 kids a year in the US alone? There's only a 50% survival rate. Well, now you do. It's CDH Awareness Day. Please donate to help the kids.